Our next speaker is Heather Iezza. Heather is a pediatrician with Annandale Medical Group. She's been here for 8.5 years. She did her undergraduate at UC Davis, her medical school at Franklin University in Chicago, and then did her pediatric residency at Stanford. Heather's going to talk about, among other things, vaccine controversies. I'd like to recommend Heather in this way. She's our kid's pediatrician. All right, thanks.
Thank you. Thank you for inviting me to come today to talk to you about a subject I spend a lot of time talking about with my patients, but even more so the parents of my patients. I realize some of you don't treat children, but you probably all have children in your lives, and so hopefully this talk will be applicable on some level. I have no disclosures. So first, a little bit about me. I joined Annandale Pediatrics in 2010. My partners are Dr. Deborah Britt, Liz Colhane, Dan Greenfield, Ken Prosser. We work with two amazing nurse practitioners, Dan Hayes and Emily Pope. Some of you may know my husband there, Superman, Alex Iezza. He's an orthopedic spine surgeon with Rosa. And we have 3 super kids, which I'm happy to say are all fully vaccinated. So I think today's society has really taken vaccines for granted, and we're starting to realize that now as diseases that have been largely eradicated are now kind of coming up and feeling way too close to home. I like this little cartoon here. It says, slowly he would cruise the neighborhood waiting for occasional careless child who would confuse him with another vendor. We try to disguise our vaccines with stickers and smiles with our patients, but ultimately they are shots and they're not pleasant, but they're important. So a lot has changed. In 1977, there were 4 vaccines that covered 7 diseases. In 2019, we have 14 vaccines that cover 17 diseases. So a quick little show of hands here in the audience. How many of you have treated conditions like diphtheria or polio? A couple. Hib meningitis. That was very common, cause of meningitis in infants. Tetanus. Much more. And measles. And then chickenpox, probably many more of you. Honestly, in my career, the only disease from this list that I have treated personally was chickenpox, and it was a case during residency. So I have not seen these diseases in person, and I feel fortunate for that. Oh, I wanted to point out this website. It was called thehistoryofvaccines.org, and I came across it while I was preparing for this talk, and I found it to be fascinating. It shows a comprehensive display of the history of vaccines. It talks about the historical disease outbreaks when the vaccines came into play. And it really shows how fortunate we are, like where we came from and how fortunate we are today. Really quickly, I'd like to just go over the vaccine schedule. So this is the vaccine schedule recommended by the American Academy of Pediatrics, American Academy of Family Practitioners, and Centers for Disease Control. On the left, we have from birth to 6 years, and on the right, 7 years to 18 years old. At our office, we try to keep it as simple as can be. We coordinate all of our well child checks with vaccines. So infants come in and toddlers come in typically every 2 to 3 months for their well checkup. And they usually get about 2 to 3 shots per visit. There is an oral vaccine that we give as well. So by 2 years old, most of our patients have received all of their initial vaccines. They come back still every year, but don't get another booster shot until their kindergarten physical. And then they don't get any more vaccines until their 10-year-old to teen visits, where we make sure they get their Tdap booster, their HPV series, and their meningococcal series. But of course, you can't forget the annual flu vaccine. We're big proponents of that. We hold weekend clinics to make it easier for families to come in and get it. And we try to make it as easy on parents as possible. So it seems pretty straightforward, right? Just follow the schedule, your patient comes in, you recommend these shots, and they get it. Well, unfortunately, it's not always that easy. A lot of my parents come in with big concerns. They either don't want to vaccinate their child at all, or they want to follow their own vaccine schedule that is largely based on unsubstantiated, just they come up with it on their own. They get a lot of their information or misinformation from Google, Facebook, friends and family, and it gets really overwhelming to them to know who to trust. So the American Academy of Pediatrics is trying to combat this by urging technology companies like Facebook and Google to combat the vaccine misinformation. And they really are trying to make it easier for parents to know, okay, is this a reliable website, or is this just made up stuff that doesn't have any basis in science? This is in the news every day. Every day I watch the news, there's something about the measles vaccine. Right now we are up to, I think, 387 cases this year and counting. The closest I just learned last night is at UC Davis. So it is getting very, very close to home. It's also entered the political debate. There was this article in March that a lawmaker said mandatory measles vaccine shots are communist. And there's just something in those vaccines, and we shouldn't be enforcing or making these mandatory. So in came our California vaccine law, SB 277. How many of you have heard of this vaccine law? Probably most of you. Was in response really to the Disneyland measles outbreak that happened in 2015. There was 147 cases of measles, all linked in some way to Disneyland. Either the patient was there and was exposed to it, but it kind of had this trickle effect that was all linked to Disneyland. So when parents come in for their MMR vaccine, I'm like, and now you can plan your Disneyland vacation. It was co-written by a pediatrician and California State Senator Richard Pan. The bill was implemented in 2016. And basically what this bill did is it eliminated the personal belief exemption. For any student entry into public elementary schools, secondary schools, or even private schools. And homeschools is kind of an interesting topic too, because it actually affects a lot of kids who are homeschooled, because if they use any public school venue for part of their education, they too have to abide by this law. It includes daycare, so kids who are going off to daycare, any licensed daycare, they also have to abide by this law. And it makes the vaccines mandatory for every student unless the student has a medical exemption. Currently, this is just for kids entering kindergarten, entering 7th grade, or entering high school. So if they had a personal belief exemption and are in between those age groups, they're kind of grandfathered in until they meet that next school entry point. So what vaccines are required by the schools? We have DTaP, Hepatitis B, polio, Hib, which is Haemophilus influenza B, MMR, and varicella. So it is not the comprehensive list of vaccines that we recommend to our patients. And so it's not all of them is what my main point is there. So what are legitimate medical exemptions? You can find them listed on the Centers for Disease Control website. And I'll kind of read them off to you here. So severe anaphylactic allergic reaction to a previous dose of vaccine, severe immunodeficiency or recipient of antibody-containing blood product, and that's specifically for the live vaccines. This is the one I see the most in the office, moderate or severe acute illness with or without a fever. It's really hard this time of year to have a healthy, well child. So they usually come in with a cold or with something else going on. But if it's a mild illness, they don't have a fever, I still encourage the parents to get their vaccine. Guillain-Barré syndrome less than 6 weeks after receiving a previous vaccine, encephalopathy, uncontrolled neurologic disorder, epilepsy. And this is the one that gets a little bit misunderstood, I would say, a family history of immunodeficiency. So if the patient does not have that immunodeficiency, that would not be a contraindication. And as you can see, most of these are you have to have had an actual vaccine to qualify for these. So if you've never had a vaccine and you're saying, I am medically exempt from all vaccines, it's how do you show that? And the other thing that I'd like to point out is a lot of these are temporary. So, for kids who have cancer and undergoing chemotherapy, they're immune deficient, so they would not be eligible to get the live vaccines. But once the chemotherapy is complete and they are now healthy, they can then be vaccinated. So the law states that to get a medical exemption, the parent needs a written statement from an MD or DO licensed in California, and you have to be very specific. You have to say what the medical circumstance is that makes the child exempt. You have to list exactly which vaccines they're exempt from and state whether it's temporary or permanent. And currently, these letters are getting submitted to the schools or the daycares. The schools don't really have any authority to challenge the medical exemptions, and there's really no oversight to this process. So we're seeing the medical exemptions on the rise for parents who are declining vaccines. And before the law took place, there was only about 0.2% or less, so minimal, kindergartners would receive a medical exemption each year. Since the law passed, that number has increased threefold. Medical experts estimate only about 3% of children at most should be exempt due to a serious health complication. And I'm going to show you that there's some schools where over half of the student body has a medical exemption. Despite these statistics, the vaccine rate is at its highest level in the past 15 years, the spring of 2017. So shortly after the law passed, the vaccine rate went up to the most it ever had. So the law is still very successful. So where is the California kindergarten with the highest medical exemption rate? It's right here in Sonoma County. So the Sebastopol Independent Charter. Only 36% of students have received all required vaccines. Only 42% are immunized against MMR, and 58% of those students have a medical exemption. So why are these medical exemptions on the rise? I found this great article that talked about, how are these patients finding these doctors to write these medical exemptions? And there was some concerning statistics that they brought up. One is that out of the 20 schools, most of them in the Northern California, the rate of medical exemptions amongst incoming kindergartners was a stunning 1 in 4. So that's a lot of unvaccinated kids in a relatively few places. And it is likely that these medical exemptions do not meet the criteria outlined by the CDC. In researching this, I Googled how to get a medical exemption. I found several websites, this was one of them, that lists doctors all up and down the state of California that are willing to, or may be likely to write a medical exemption. And some of these doctors are actually profiting from this and aren't actually the treating physician or the family physician. They're solely to just grant the medical exemption. So SB 276 to the rescue. So the pediatrician, Senator Richard Pan, is now proposing this new bill, which just came out this March, where he proposed that physicians would then need to submit the information to the California Department of Public Health. They would have to certify that they actually examined the patient. So it can't just be a letter written out. They have to say, I examined the patient. And then it would be entered into a state database where they would monitor all these vaccine exemptions and which doctors they're coming from. And here's the biggest change that I think will happen from it, is that the state and county health officials will have the ability and authority to revoke exemptions. So if they're not according to the CDC guidelines, they can say, sorry, this isn't a valid medical exemption. So how are we doing in the rest of Sonoma County? Hopefully you can see that okay. Yeah, so there's a great website. It actually comes from our public health department, where you can look up any school, any daycare, and it'll show you exactly what their rate of vaccination is. It's mandatory that the schools and daycares report to it. And most of the schools are in the green zone, or the little green dots that you can see on the screen. And that means they're greater than 95% fully vaccinated. There are some schools that you can see that are in the red or orange, which are going to be very vulnerable to disease outbreaks because they're less than 90% and even some less than 80% vaccinated. A few slides from our public health department. This just kind of shows the time from 1999 all the way up to 2017, where it shows the percent of kindergartners that are required with all the required vaccines. And really what I want to show you is here's the passage of the law, a huge spike in red, which is the California rates, where it spiked up to 95% of kindergartners receiving all their vaccines. And in blue is Sonoma County, so we had less of a spike, but still significant, up to 93%. But you see both rates are dipping here in 2017. Another slide just to kind of show from years 2014 on to 2017-18. In purple is the personal belief exemption, which you can see once the law passed, goes away. So now in 2017-18, there's no more personal belief exemption. But then the medical exemption is this little light green. You can see as after the law passed, it tripled and is going up. So the next few slides, I just want to kind of give you an idea of what are our disease rates here in Sonoma County. And for pertussis, this is the one I probably see the most of. We had an epidemic last year, and we're already entering an epidemic year with, at the time the slide was published, with 13 cases. Several of the schools in the area have had notices that said your child may have been exposed to pertussis. We've had positive cases in our office. And unfortunately, a lot of these kids that I've seen that have tested positive for pertussis were actually up to date on their vaccine. So they had their DTaP at kindergarten, and they aren't 10 yet, or they're 10. They had the 10-year-old Tdap, but now they're 14, 15, 16 years old. And we base the booster for the Tdap on your tetanus, right? You need to get your tetanus every 10 years. But what we're seeing is that the pertussis immunity is waning after as little as 3 years. So these kids are getting pertussis even though they were vaccinated within the normal time frame. And the hard thing about this is when you then have a large population that's not vaccinated, then the numbers really spike up, and then those who were vaccinated are now more vulnerable. So measles, there actually have been no locally acquired confirmed cases of measles. The two that they had were likely imported cases. But as I pointed out, these hot spots of kids who are unvaccinated are going to make it very vulnerable to an outbreak. A similar slide, but this shows back in 1956 where there was lots of measles cases in the county. The highest was, I think, in the 1960s where there was 1,000 cases in the Sonoma County. And then the first vaccine was developed, and you can see the cases go quickly down to almost none. And then the booster vaccine was here in the 1980s. And then it just shows the two cases, suspected cases, but not confirmed, and then the one confirmed case from a traveler that was from outside of the county, outside of the country. Mumps, we don't get a lot of mumps cases here. There was one in 2016, two in 2017, and one in 2018. A lot of the mumps outbreaks are on college campuses, and largely these have been contained using mass vaccination campaigns. So if they start seeing more and more college kids getting mumps, all of a sudden they just really push the MMR vaccine booster, and that gets contained. So I'd like to give you a better understanding of why parents are concerned about vaccines. And there can be many different reasons, and sometimes it's hard for parents to say why they're concerned, but I wanted to at least give you an idea of what I typically encounter. Probably the number one reason I hear is this is especially for parents of newborns and infants, is they're afraid that their baby's immune system will be overloaded by giving too many vaccines. So the idea that too many too soon, they just want to wait until they're older, wait till their immune system's more developed. Some parents are like, why are we vaccinating for polio? There is no polio here. And they say that about measles, but now that's less of a statement. But this idea of like, do we need to vaccinate still for conditions that are no longer we don't no longer see every day. Some people really think nature is best, so they want natural immunity. They don't want their child to develop immunity from a vaccine. They want them to actually get chickenpox and have natural immunity, because natural is always better than artificial. The vaccine ingredients is probably another one that I hear commonly. It is daunting. If you looked at a vaccine label, it's like tons of chemicals, things that you don't understand, and if you don't have the context to understand how those work, it can be really overwhelming. I still do hear about the autism link, although that has been less so. And there's so much misinformation readily at their fingertips that it's really hard for them to know who to trust. So first, the too many too soon or overloaded immune system theory. The explanation I give to parents is, although kids receive more vaccines today than ever, the number of immunological components or things that make the vaccine work has dramatically decreased. So in 1977, when we had those 7 vaccines, they needed 3,000 immunological components to make the vaccine effective in the body. Today we have 14 different vaccines, but only need 150 immunological components. So even though we're giving more vaccines than we did in the 70s, they're actually less of an overload to their child's immune system. So can too many vaccines overwhelm an infant's immune system? No. Kids, we know, put everything in their mouths. They play at the playground. They crawl on dirt. They do all these things. And the daily challenge that their immune system gets from just being a kid is way more than what the vaccines do. So what about severe diseases? I try to explain to parents that we're not here in a bubble. We have travelers from all over the world who come to Sonoma County, and not to mention how many of my patients actually travel to other parts of the world. Polio is widespread in other parts of the world. Measles, I was really actually shocked to see this, 83,000 cases of measles in Europe last year. Tetanus is one that kind of struck my interest also. There was just a case last month that a boy hit his head, cut his head, and got tetanus. It took 2 months of hospitalization, a lot of which in the ICU, $800,000 of medical bills, and thankfully he recovered. He was unvaccinated, and surprisingly, when his parents were asked, would you have done it differently? They said, no, we would still choose not to vaccinate. So sometimes it's not a rational, or what I would consider to be a rational decision. And in that case, I would say probably natural immunity was not better than vaccine acquired. So what about the ingredients? Aluminum salts. Aluminum salts are something that help make the vaccines more effective. Aluminum is present in our food, it's present in our air, our water, it's in breast milk, it's in formula. One vaccine, the amount of aluminum in one vaccine is equivalent to about a day's worth of formula for a baby. So knowing that context can make the ingredients seem a lot less scary to parents rather than just saying, oh, there's aluminum in vaccines, or formaldehyde. So the formaldehyde is used to detoxify the vaccine or inactivate a virus in the vaccine, and the tiny amounts that are in vaccines are safe. And again, much higher amounts that are naturally occurring in our body. Egg protein is a concern I have from some families that have egg allergic children, and generally the egg protein that's in vaccines is very safe for children who are even egg allergic. So do vaccines contain antifreeze? Sometimes you'll see this on anti-vaccine websites. Vaccines contain antifreeze. Well, ethylene glycol is what's in antifreeze. It's not in vaccines, nor would it be safe to be. Polyethylene glycol is in vaccines and is safe. And mercury is something that had a lot of debate. Methylmercury is not in vaccines, nor has it ever been, but thimerosal is a mercury-based preservative that is used in vaccines. There was an MMR autism link scare that happened in 1998. A investigator, Andrew Wakefield, published in The Lancet an article linking MMR to autism. And from that, the thimerosal was removed from most vaccines in 2001. However, multiple studies that have been published since have shown there is absolutely no link between autism and vaccines, or thimerosal and vaccines and autism. And the Lancet article was later redacted and disproved. Andrew Wakefield lost his license. It's been a lot of since things after that. So does MMR cause autism? Again, no. Last month, there was a nationwide cohort study that investigated the link between the MR vaccine and autism. Studied over 500,000 children for over a decade, and the study strongly supported that there was no increased risk of autism, there was no trigger for autism in susceptible children, and there was no associated clustering of autism cases with the measles, mumps, and rubella vaccine. So what are my strategies? How do when I have a family in the room and they say, sorry, Dr. Iezza, we don't want to vaccinate today, or we want to wait to vaccinate until our babies are older. Well, we start really early. Really, it starts in the hospital. When the babies are born in the hospital, typically they're given their Hepatitis B vaccine on the first day of life, before they even leave the hospital. Hopefully the moms have already received their flu vaccine and their Tdap vaccine while they're pregnant, so our OB/GYN colleagues are usually the ones who are initially educating them about vaccination. I really try to listen and understand what their concern is. I don't go into this I don't bring out my PowerPoint and go through all these different slides. I really try to figure out what is their concern and address that specifically, because it can be overwhelming if I start saying too many things that they weren't even worried about, and it can do a whole steamroll. So I tend to just keep it very simple, and I try to be empathetic. I try to understand where they're coming from. I know that they love their child more than anything. They want what's best for their child, and they're really just trying to do what's best and are looking for guidance. I think the most effective thing I do is I use my own family as an example. I reassure them that I've vaccinated my kids on this exact same schedule, and I wouldn't do or recommend for them what I wouldn't do for my own family. And then we have an office policy. We expect and actually require our families to stay on schedule and to keep up to date on vaccines. All 7 providers in my office feel the same, and we're very unified, and we talk about safety, so patients can't pick and choose between us, like, oh, we know so-and-so will let us not get vaccines, but so-and-so will. We really make it an office-wide policy, and we find that that has really helped our patients and helped each other with this fight. The other things I talk about is just our patients that are in the office. We do have patients who are under chemotherapy or have immunodeficiencies, or who are just infants and frankly aren't old enough to get their measles vaccine. And so we talk about how it's important for all of us to band together to protect our community. And I find this actually is very effective with my teenage patients. When they don't want to get their Tdap vaccine, I say, look, do you babysit? If you babysit, this is something that you need to have, or do you have younger brothers or sisters? This is something you need to have to protect them. When parents delay vaccines and come in at older ages, 5, 6, 7, and now have to do a lot of vaccines at an older age, those kids are freaked out when they come. And I find that when we complete the vaccine schedule by age 2 and just have a few booster shots, it's much more manageable to the kid. And then the real issue is putting their child in unnecessary risk. By delaying the vaccine and waiting till they're older, puts them at risk for things that they could acquire now and frankly are more at risk for getting sick with and are more vulnerable to the disease. And then inconvenience. It is not easy to schedule an appointment, show up on time, come in every 2 weeks to get your child vaccinated. So to come in every 2 to 3 months on the well-child schedule is much more convenient for parents too. There's a few resources that I will point them to. The American Academy of Pediatrics website is fantastic, healthychildren.org. The CDC website is actually great. They have a lot of patient-friendly information sheets. Immunize.org has great information as well. And then really it's just warning about misinformation. Facebook, anti-vaccine websites like the National Vaccine Information Center. That sounds really legitimate, right? National Vaccine Information Center. It is an anti-vaccine website. If you were a parent and you came across that, it is going to convince you not to vaccinate your child. And it's really based on no science. And then, of course, celebrities. They're the best people to get information from, right? So this is just to kind of lighten it up a little bit. So we have some of our celebrities who are anti-vaccine. Jenny McCarthy was probably the most vocal anti-vaccine celebrity, really perpetuating the autism vaccine link. It entered the political debate 5 years ago. Donald Trump tweeted, "If I were president, I would push for proper vaccinations, but would not allow one-time massive shots that our small child cannot take, autism." There are so many things wrong with that statement, I don't even know where to start. But we also have our pro-vaccine celebrities, and these celebrities use their voice to share their personal stories of how vaccines either helped or could have helped their child. And I think it's great to have an opinion, but as a pediatrician, it's really hard when I find that some of my patients are trusting recommendations from people that really don't have credibility in my mind, and so it gets difficult. So what can you do to help? I realize not all of you treat kids, but your opinion really does matter. Matters to your patients, to your family members, just the community. So please recommend vaccines emphatically. Share the stories of the days of treating diseases like meningitis, polio, measles, chickenpox. Recommend the Tdap booster. As I said, the pertussis immunity is likely waning after about 3 years post-booster. So this is most important for pregnant women. They actually get a booster vaccine with each pregnancy. It doesn't matter how many years between pregnancies. If you got pregnant 2 years after your last baby, you're going to get your Tdap booster again because it actually allows passive immunity to the fetus. So that goes for caregivers and grandparents of new babies. So just think herd immunity. Recommend your yearly flu shot. The morbidity and mortality is highest amongst pediatric patients, pregnant women, and elderly. And if you do take care of any teen patients, the HPV series, the meningococcal vaccine, Tdap booster, and annual flu. And thank you for your attention, and please feel free to ask any questions or comments. And real quick, thank you. Quick shout out to Dr. David Smith. This is a great picture of him in the Press Democrat pre-retirement where he's proudly holding an influenza vaccine.
You said that you expect and require vaccines of the patients in your practice.
Oh.
Do you discharge patients from your practice who refuse vaccines?
We really try not to. That's only happened to me personally just a small amount of times. I really give families chance after chance after chance after chance to, but I think just having the policy lets patients know that we're serious. We're not just saying this just to say it. We feel it's that important.
Can I ask, how do you talk about rotavirus and intussusception risk?
Yeah, when I was a resident, the old rotavirus vaccine was taken off the market and because of increased intussusception risk. The new rotavirus vaccine has not had that as high of a risk. I'll say there is still a risk, but when we look at risk benefits, and this is true for all vaccines have side effects. We know what the side effects are, but when you look at the risk of acquiring a disease and morbidity, mortality from that disease versus the risk of a rare side effect, that's the term that I put it in. But surprisingly, a lot of parents don't ask about that.
Just a question about waning immunity.
Mm-hmm.
So we see that with Tdap, thank you for the info on the 3 years, but also hepatitis B,
Right.
MMR.
Yeah,
do you have any recommendations around
how to do
rechecking
that?
titers or?
No, I have a couple of 18-year-old applying to nursing school. They need all their titers done, and it's kind of shocking how many show no immunity to the vaccine. And I think what I take away from that is that important for all of us to be vaccinated, because if we know the vaccines aren't perfect, but we have a greater than 95% vaccination rate, well, then that's going to give our whole community, we're not going to be exposed to the disease. Question back there?
Yeah, how do you handle situations where patients are uninsured and not eligible for Medi-Cal or whatever, and similar situations where the patient has a health savings account, so it's
Right.
out of pocket.
Yeah.
One of the things I've noticed in the 40 years I've been doing this is vaccines have gotten ridiculously expensive. And we could argue that all day, but the bottom line is, how do you handle those situations where it's cash out of the pocket? And I'll just anecdotally tell you that I have sometimes been in situations where I offered to do it for free and just eat the cost because that convinced the patient that I was serious.
Yeah.
But anyway, how do you handle
We
it?
have a reduced rate for out-of-pocket players where, David, do you remember it's like $15 or something?
We've got to
It's,
talk about that.
yeah.
Essential health benefits, which we have under the Affordable Care Act, provides that vaccines are the ones with no co-fee, okay? It's essential health benefits. So anybody with a legitimate insurance policy will have that covered. The second program that is available is called Vaccines for Children, so we paid for it with our tax dollars. They can get it, and we have, most offices have a supply where they get it for free. They may be charged an immunization fee, an injection fee.
Administration fee.
However, we cannot, by the rules of that being provided and placed in the office, if they can't pay that administration fee, they get it for free. So there really shouldn't be no financial obstacle to getting your immunizations. Okay, so if you haven't discovered how to get those things, contact public health. They're really good advocating for that.
Yeah, their website basically lists how to do it. Yeah.
So a question about hepatitis B and the one you do at birth.
Yes.
The pushback that I get is when it's given at birth, then when they come in at 2 months, there's a combination that includes
Right.
hepatitis B.
Correct.
And they don't want to do that because they've already got the first one. So then we end up giving them a lot more individual vaccinations.
Right.
And I know you can, give 4 hepatitis Bs, that's okay.
Right.
But when you're talking to a reluctant population, it's
Right.
harder to sell that. So if you know a mother is hepatitis B surface antigen negative at birth, are you obligated to give that hep B at birth?
No, as far as for the vaccine law, it's by school entry or daycare entry, so that's not an issue for that. But as far as the answer I give to families with that, because I do get a lot of moms that come over, they're like, oh, well, if they explained it to me that way, I would have done it. The reason why they give the newborn the Hep B vaccine in the first, usually 24 hours of life, is to prevent mom-to-baby transmission of hepatitis B. Now, moms are screened, and they typically are screened negative, and if they're screened positive, they actually get a whole nother vaccine. But when they're screened negative, there is this theoretical risk where they could convert to positive, or the test was done too early, or they acquired it after the test was done. So there's this interim period, and so there was still getting children or babies who are getting hepatitis B, where giving this vaccine at birth would have prevented that. Does that answer your question? But as far as getting the extra one, I don't worry about it. I mean, like with my kids, they got it at birth. I knew it was Hep B negative. I still gave it at birth, and then they got it again at 2 months old.
At my clinic in Fort Bragg, we give the Vaccines for Children's program you're talking about, but I don't think they're covering the Meningitis B, Men B. Do you have any comments about that?
So Men B, there's 2 meningococcal vaccines that we give to teenagers. Well, one is first given at age 11, and then the booster at 16. And the other one, I believe that's the Men B one, because the first one is the 4-valent one, but the Men B one, it's not totally clear who is supposed to get that. It's not supposed to last very long, so if you give it at 18 or 15 or 12, whatever age, well, how long does it last? So what we've done in our office, or what I do, is I give it to my college exiting teenagers, or my teenagers who are going on to college, because they're highest risk. But I tell them, if there is a meningococcal outbreak at your school, you should get another booster just in case this one has worn off.
Can you comment the new HPV 9, and do we need to turn around and give the 9 to kids that got the original?
I don't know I'm not a vaccine expert. I mean, I'm a pediatrician. I prescribe a lot of vaccines, but I don't know all the details with that. We have not been revaccinating old patients, no, not in our office. Oh, one more question?
I got it. For medical exemptions, if you have a new family in your practice, if you have a new family in your practice who comes in saying, we have, my child has a history of moderate or severe anaphylaxis to immunization, do you require documentation? Do you say, okay, I'll write you the letter?
Yeah, I haven't had that specific situation. I've had some families say, oh, we have a medical exemption we for XYZ immunodeficiency or metabolic derangement syndrome, whatever the condition that their child has. And the way I've chosen to handle that, I said, oh, so your child must be seeing a geneticist, a metabolic specialist, an oncologist, a hematologist, whatever the specialist it is, and I request that they get their documentation or their letter written from that specialist, or I consult with their specialist, because I do have patients with seizures, and that's kind of the gray one. It's like, well, what's an uncontrolled seizure disorder? Is one seizure a year uncontrolled, or is it or unstable? Yeah, so it can be tricky, so I really rely on the specialist. Now, if they don't see a specialist, then or their specialist is in a different discipline, like naturopathy or something else, then it gets a little bit tricky.
Just a quick question about influenza. So in your practice, this time in the year, as we're getting towards the end of the season, how much of a push, or what is kind of your policy on now versus just waiting until the next season?
I had a positive case last week, so I'm still, especially for infants, recommending it. If they're a healthy 15-year-old patient with nothing, I kind of leave it more up to them, but I always encourage it, and I say, and next year, come in by Thanksgiving or Halloween. I usually give those 2 holidays, and I say, we'll have vaccine clinics come in, get it early, so that way it lasts the whole season. Okay. All right, thank you.
Thank you very much.